Dear attendees, welcome to our roundtable. Our panelists are now going to virtually take you to their clinics. They are going to summarize how exactly they incorporate MASTERCLASS into their portfolios and share with you some interesting facts. The live roundtable discussion will follow right after. Enjoy! If you have any questions, please ask us in the bottom right corner of your screen. If you have any technical difficulties, just let us know in the chat.
I'm Joel Cohn, a board-certified dermatologist at About Skin Dermatology in Denver, and we have the MASTERCLASS technology in our practice as well as really the suite of BTL technology. MASTERCLASS stands for M is electromagnetic and CELLA is chair, and basically this is a chair where it's non-invasive treatment. There's no pain, there's no downtime. It's 6 treatments about every 6 months. So it's twice a week for 3 weeks. It's a 30-minute session, and patients have improvement in documented studies for urinary incontinence. Patients have improvement in overall pelvic core to floor, the floor of their pelvic area in terms of contracting these core muscles and really giving people overall more strength to that area. And now there's some exciting new sexual function studies as well. And it's really a treatment you do in the office without downtime, without pain. You keep your clothes on and the treatment's on right now, and this is something that we're really excited about, and we use it in the context for many of our patients who also want to do M-Sculpt Neo for the abdomen or the flanks or the buttocks or thighs, and we also use it in the context of patients who may want to do this for M-Tone for laxity and tightening of the skin, and we did the FDA trial for M-Face as well. So the BTL suite of M-Sculpt and M-CELLA and M-Tone products are very exciting. M-CELLA fits right in with this high intensity focused electrical muscle stimulation. No pain, no downtime, keep your clothes on, and help stress urinary incontinence and also help overall pelvic musculature, as well as these really exciting sexual function studies. So many of our patients who live in Colorado report that after treatment with MASTERCLASS, when they're skiing the moguls, they have less urinary dribble. Some patients report when they jump on a trampoline or do these high impact workout therapies where they're jumping up that they have less urinary dribble, and men report improvements in that as well.
I'm Dr. Amanda Holden, CEO of Holden Timeless Beauty, a multi-location medical aesthetics practice in Southern California. We primarily see patients to treat them with minimally invasive things like neuromodulators, dermal fillers, and then we have the entire collection of BTL devices. I purchased my first BTL device, the M-Sculpt Classic, in 2019. Soon after, I added the M-Tone and the M-CELLA, followed by the M-Sculpt Neo, and now recently the M-Face. The M-CELLA was something that I considered for a little while before purchasing because I am not an OBGYN. I'm formally trained in emergency medicine and transitioned into the medical aesthetics world kind of in the non-core way that many people do. And I didn't know if this would be a good supplement to the patients that I already see. But the fact of the matter is, there are many women that have vaginal deliveries, and for over 6 years, they don't talk to anyone about this. So it's a very easy thing to bring up. Hey, have you had any urinary incontinence after your vaginal delivery? Well, I have a device that can actually help strengthen your pelvic floor and help with your sex life in strengthening the entire pelvic floor and increasing the blood flow in that area. And when women start to realize this about how quick and easy this device is, you can remain fully clothed, sit down for a 28-minute session, well then they really have that aha moment that this device is incredible. And in fact, for women that had sought treatment earlier, they said this device was better than any other treatment out there. In addition to the pelvic floor treatments, say for a woman with urinary incontinence that might have been post-childbirth, this device is incredible for strengthening the pelvic floor as people get older. As we get older, we lose our muscle mass at a rate of 3 to 8% per decade. And it's really important to strengthen your entire core, your abs, your glutes, and your pelvic floor to keep yourself upright and active throughout your daily activities. And it really makes you feel stronger and live longer overall when you have a good physical shape. So when we talk to our patients that are a little bit older about how they're going to address these areas, our core to floor combo treatment is a perfect solution.
Hi, I'm Dr. Tricia Wallace, and I'm a urogynecologist trained in female pelvic medicine and reconstructive surgery. And I specialize in the evaluation and treatment of pelvic floor disorders, including urinary and bowel dysfunction, post-childbirth pelvic floor restoration and body wellness, as well as pelvic health and sexual wellness for women and their partners. When patients come to see me, they're looking for restoration of quality of life. And I review all treatment options, including non-surgical and surgical options when appropriate. Leaking urine is not normal, although it's common. In fact, did you know that we sell more adult diapers in the United States than we do baby diapers? And women want good sex lives too, yet there's no Viagra for women. Finally, we have a solution that can address these issues without surgery, injections, or downtime. I am currently studying pelvic power, the combination of MCELA, high-frequency electromagnetic therapy to the pelvic floor, along with radiofrequency, MFEM, to the feminine tissues, restoring and enhancing urinary control, core to floor strength, and sexual wellness. Improving tissue health, blood flow, continence, and sensation results from treating the area with radiofrequency and high-frequency electromagnetic energy, restoring core to floor strength. The pelvic floor is the foundation of the core. When you add Emsculpt Neo to the abdominal wall and the glutes, you have now complete core to floor restoration. This is most important in athletes, post-childbirth, post-prostatectomy, baby boomers, and patients with chronic back pain. When women find out that there's a non-surgical way to restore continence and confidence in sexual wellness, there's a sigh of relief. I talk very openly and frankly with my patients and their partners about their pelvic and sexual health goals, including other treatments that will enhance further their quality of life, including hormone optimization, diet, nutrition, and not forget the importance of exercise. I always emphasize that I want my patients to live their best lives in their best bodies.
Hi, I'm Dr. J.D. McCoy from Contour Medical in Gilbert, Arizona, and I've been practicing non-surgical aesthetic medicine and wellness for almost 20 years. And a key part to my practice is thinking about not just outer body wellness, but inner body wellness, and recognizing that my patients want to look good and they want to feel good. And one of the components to my practice that really has elevated the art of what I'm able to deliver for my patients is the incorporation of not just the MCELA chair, but also the Emsculpt Neo, and basically this concept of utilizing high fem in the practice, using focused electromagnetic energy to stimulate muscle. And what does that do? It really causes a functional change in patients that can change their lives. Because what you realize is when you can improve functional strength, when you can improve sexual wellness in a patient, you transform them. And you also get the most loyal and committed patient, because when you change a patient in that way, they're yours for the long haul. Because I say it's a marathon, not a sprint. And a key part of that in the practice is incorporating MCELA chair, core to floor. And I really found that came to heart when I not only saw it in my patients, but also saw it in the data from the core to floor study we did with postpartum women, seeing the kinds of changes that you can make in core strength and their quality of life. I'm really excited to be able to share that and hopefully elevate everybody else's art in the process. Cheers.
Good day everyone, I am Dr. Diana Mihai, President of the Romanian Society of Aesthetic Gynecology. Today we are here at Ladies Excellence Clinic and I want to talk to you about the MCELA chair. My patients absolutely love it. For example, if they have laxity after child delivery, even if it's C-section or natural delivery, they have very good improvement if they have urinary incontinence. That can be either stress urinary incontinence or due to imperiosity, urgency urinary incontinence, or even mixed urinary incontinence. I had patients that told me that they were leaking urine just by walking, When they were walking to the supermarket, they had this problem. When they were going to work, they had this problem. And after 10 sessions of the Emsella chair with no pain, just staying with their clothes on, they only had some urinary incontinence when they had a very severe sneezing, for example. So very good improvement in the quality of life. Another kind of patients that are very satisfied with the Emsella chair are the patients with vaginismus. These patients have a very severe spasm in the perineum, and the Emsella improves the contraction and the relaxation of the muscles, so the muscle will be trained how to relax and how to contract. As well, I'm using sometimes Botox in addition with this kind of procedure. So patients with menopause that have different problems, laxity, modifications in their love life, have very good improvements with this machine as well. Even I have couples that come together, the man and the woman, because what do you know, it's good for urinary incontinence or erectile dysfunctions for men, especially after prostatectomy. And they come together. First, she sits on the chair, he sits here, they are talking, they are reading some books, they are discussing, listening to music, and then they switch. The man sits on the chair and the woman sits on the bench, and they continue having a pleasant time together. So it's good for women, it's good for men, it's good for urinary incontinence, for laxity, and so much more. You should really try it.
Hello, my name is Dr. Maximilian Franz, and right now I would like to give you some insights about my experiences with Emsella in my office. I came upon Emsella in late 2019 in addition to vaginal laser therapy in case of incontinence. Starting in late 2019, we had about some 5 to 10 patients per week. The satisfaction with the Emsella therapy was very high from the beginning. And the benefits are that it's a walk-in, walk-out therapy. It can be done by the nurses, and you just can sit there while you have the treatment. It's not uncomfortable, and you don't have to do anything else but sitting on this Emsella chair. The success was that high that meanwhile we bought a second one, as we are treating about some 40 to 60 patients per week in the meantime. I am very happy with Emsella in my office, and I'm sure that you will be too.
How can you help your patients get the best possible results? First, set the height of the chair. Feet shall be flat on the ground. Second, start the Emsella targeting mode to position the patient correctly. They should sit in the center of the chair. The most important steps: keep your back straight. Tilt the pelvis to position it correctly. Your legs should be at a 90-degree angle. Increase intensity according to patient's tolerance and wait for their feedback. The patient should feel gentle pulses tapping over their perineum and pelvic floor muscles. The pelvic floor muscles are contracting.
Thank you all very much for joining us. So first, Dr. Wallace, as a urogynecologist, educate us on really the anatomy in the pelvis and really how Emsella works.
Well, good morning. I'm so happy to be amongst these amazing physicians, and this is just great information to share across the world. As a urogynecologist trained in female pelvic medicine and reconstructive surgery, I have a lot of experience with pelvic floor disorders. And so whenever I talk to patients or other colleagues, I speak about the importance of the pelvic floor. So the pelvic floor is made up of many muscles that actually hold your bony structures together and help us with our balance, our posture, obviously our continence and our sexual function. And those muscles are the levator ani, the puborectalis, the sphincters that circle the urethra, and the anal area as well. So it is a very important group of muscles that most of us don't think about. And the other important thing about that is that men and women have the same pelvic floors. And so this type of technology can be applied to both men and women.
So really, how do you, Dr. Holden, communicate its potential benefits to your patients, and how do you integrate it into your practice?
So, well, it's also wonderful to be here with all of you, and I love to be sharing this information around the world. I run a medical aesthetics practice, and it's not the first thing people ask about when they come in. They're typically coming in for neuromodulators and dermal filler. So what I do is I have them fill out a 2-page questionnaire that asks about all of their patient concerns in layman's terms. And we include a question about urinary incontinence and sexual health, whether or not they need help in those areas. And if they check those boxes, we begin the discussion. If they don't check those boxes, we have these in our bathrooms. So we have all 3 of these. And this one is staring them right in the face, say no to incontinence. And oftentimes they'll come back holding this if they've been an existing patient going, tell me more about this chair. And I say, you know, it's an incredible device. You remain fully clothed, and it is going to contract your entire pelvic floor and really strengthen your muscles in that area to give you relief of your urinary incontinence, increase blood flow to your vaginal area if I'm talking to a female, and really more core strength overall. We treat a ton of patients that do Emsculpt Neo, so we encourage them to combine Emsculpt Neo with Emsella, and it's just a very easy conversation on either side if they check the box or if they come back with this little flyer.
So Dr. Franz, as a gynecologist, you see a lot of patients who may be interested in treatment. Can you just talk to us a little bit about the different types of incontinence and how you really delineate these diagnoses?
Hello. So hello, everybody, and nice to meet you. I'm very honored to be here today, or this afternoon in Europe this afternoon. We have the classical stress incontinence, which means that you're licking when you're pressing your abdominals, and you're, for example, jumping, or when you're coughing, or when you're laughing. Or we have the urge incontinence, which means that you have to go to the toilet very fastly when you feel the first time that you have to go to the toilet. In both ways, especially in the stress incontinence, we suggest the Emsella chair, the treatment with Emsella. However, also in urge incontinence, it helps. It helps because it increases the perfusion of the pelvis. So when you train your muscles, you also have an increase of the perfusion of the muscular structures, which is the same thing in erectile dysfunction. Therefore, we can use it for both kind of incontinences, and in very many cases, you have a mix of both cases, kind of stress incontinence and urge incontinence. So overall, you can use it more or less for all kinds of incontinence, and it's also in our German guidelines that you always start in any case of incontinence with training first, and Emsella is something like a very intense training. So I suggest it to all my patients who suffer from licking.
Thank you. So, Dr. McCoy, you've done a lot of clinical trials on looking at Emsella in combination with Emsculpt Neo. And for many of our patients, it's not just incontinence, it's really overall core strength. It's getting up from a sedentary position, and it's really having the strength as an older person. There's been clinical trials you've done looking at populations over 60. There's clinical trials you've done looking at specifically postpartum women. So talk to us a little bit about those projects that you've done.
Yeah, that was incredibly exciting, because this was actually a unique outcome in that the older population of patients actually had a higher response compared to the younger population. But basically in the postpartum women, doing core to floor, which is a combination of Emsculpt Neo with Emsella chair, and doing that on the same day, and then having the patient come back and do another Emsella chair treatment later in the week and alternating, we saw a global improvement in core strength of 27% just from doing that protocol. And that was measured using a biometric measurement device that measures millimeters of mercury pressure when the patient contracts their core. The cool thing with that is all patients noticed a significant improvement right after their first cycle of treatment. So after 1 week of treatment, they noticed a significant change. And when we looked at older populations, so the postpartum population was 6 months to 6 years postpartum. That was the patient group that we were looking at. Now in the elderly group, which was 65 and older, those patients after a series of treatment had 37% increase in core strength using the same biometric measurement. And also looking at, as you mentioned, functional improvement like ease of getting off the chair or at the same height as a toilet seat, which is practical. Like these are real changes that people have to deal with every single day as far as how easy is it to get on and off the toilet, getting up, walking distance, and significant changes very early on. And from part of the joy I have is I was responsible for uploading photography. And how cool is it? I'm uploading these photos and every single photo could easily be in a brochure. So like often I've worked with other manufacturers where, you know, you have to search through your photos and you find like the one great photo and okay, that's what gets into the brochure. Literally every single photo that I uploaded was a really significant improvement in their posture. That's the thing that I noticed significantly, meaning when you look at a lot of these postpartum women, they have an accentuated lumbar lordosis, and that actually improves after treatment. And a lot of them will have an accentuated kyphosis, thoracic kyphosis, and that actually improves too. And as an aside from the study, we also do 3D photography to scan and look at the side profile. And consistently, every patient has this improvement in posture, which in itself is actually a nice little indicator of health and longevity. So that's kind of cool.
Great, JD, thank you. So Dr. Mahai, as a gynecologist, you know, looking at the different patient populations, JD really explained the postpartum patients very nicely, as well as patients who may be older, who have just really lax pelvic musculature. How are you integrating Emsella into your practice?
Hello, everyone. So I'm a specialist in IVF as well, and I deal with patients with infertility. So part of them, what is interesting and different from what has already been said, is that we have some patients with vaginismus, for example. This means that they have severe spasm and impossibility to have contact, intercourse. So in these patients, I use a combined treatment with Botox, with PRP, and with Emsella. And maybe you can ask yourself, if these patients have a problem with contracture of the pelvic floor muscles, how the Emsella will help them. So it will help them because the device trains the muscles both to contract and to relax, because in vaginismus patients, the muscles are too contracted. So they have only the contraction without the relaxation. And on one hand, we do the Botox, or we can use the dilators, we can use psychotherapy, acupuncture, a lot of things that I mentioned to my patients. And in the same time, the Emsella chair is a very good option in combination with this in order to train the pelvic floor muscles to relax and to contract. Because, for example, I had patients not able to conceive because their problem was the impossibility to have intercourse. And after this treatment, it improves. And another interesting aspect was that there are some studies that show that it improves the vascularization in the pelvic floor and also to the uterus, ovaries, and can improve the implantation rate in the patients with infertility. I am a urogynecologist as well, so I refer my patients both to surgery or non-surgical, but I have very good results in the last 5 years with the Emsella.
So MCELA and Exilis, I do the radiofrequency treatment inside and outside the vagina as well. And patients that were leaking urine only by walking now have a normal life and only some episodes of urinary incontinence. And for men, they are good at different ages. Not only, all we know that it's FDA approved for urinary incontinence in men after prostatectomy, for example. So they have problems with erection and with urinary incontinence. For urinary incontinence in men with this condition is very good. There are moderate results for the problems with erection after this, but there are some improvements as well. And I had even patients, small patients, children, that had problems with leaking urine during the night with enuresis, and the urologist, of course, first I sent it to urologist because men have to be seen by a neurologist as well in order to rule out any other severe problem. And then they had very good results with the MCELA chair. They were coming with their parents, and they told me that they felt very good, and it was really a success.
So, Dr. Franz, let's talk about men, for example. So really, what is the thought beyond just strengthening the pelvic musculature and somehow affecting the blood flow there that leads to male quality of erection and sexual function benefits that have been looked at?
Well, actually, thank you for this question, but let me add something to Mrs. Mihai, Dr. Mihai's words with vaginism. There's one, and I forgot that before, sorry for that. There's a third kind of incontinence. And there's this kind of incontinence when you have a very tense pelvic floor muscles. So when you have the smooth muscles, very tense, and they can't relax. And if muscles can't relax, they're always too tense, and then they can't react very fastly on an information of the nerves. So this means that the reaction time on this very tense muscles is too long to react, for example, for cuffing, to react on cuffing. And so then you leak. So you might have a too weak pelvic floor, but you also might have a too tense pelvic floor. And you can feel it. It's just a clinical and a physical examination. And it can come from wrong training, or it could come from bad posture, or from an asymmetry of the legs, or something like this. However, what I want to say about all this is that when you contract this and when you train this pelvic floors with MCELA, you also can help them not to have this tense pelvic floors muscles, and then also to relax the pelvic floors. So now coming to your questions about the men, actually I'm an Obgyn. I am treating very few men, I have to confess. We're totally full with women. We had only very few male patients yet. So unfortunately, I have to say I'm not the expert for male infertility or for male erectile dysfunction or for the treatment of it. Sorry for that.
So, Dr. Holden, you treat a vast array of different types of patients in the wellness. Maybe you can comment and just sort of dovetail that with men specifically, and then we'll get into other arenas.
I know. I wish I could say I treat a lot of men. Hopefully, JD McCoy treats a lot of men. I would guess you probably treat more than I do. I treat about 99% female in my clinic. It's just the way that our clinic has been structured and what we tend to attract. So we treat a ton of women, and I can tell you that from on the female side, when females start talking about their pelvic floor strength, they do want to come in and be treated with their spouse intermittently. But it's not first the male that comes in to see me. It's typically the female that's starting to get that strength in their pelvic floor, and then the male that's also interested. My husband loves MCELA. He feels more strength in his pelvic floor from that perspective. So we do a lot of recordings on social media with him on the MCELA chair to introduce that to our female population. So just saying, I mean, if the females are watching your social media channels and have your husband or one of your patient's husbands talking on the Emsella chair about their strength, it's a great way to tap into that other population and the psychology of the female side. So JD, do you have comments and experience on that side? Do you treat a lot of males?
Yeah, my practice is about 30% male. So we see quite a few men in the practice, and they love the chair. I demo the chair a lot with my male patients. What I've observed since early on is men tend to have very weak pelvic floors, meaning from my experience, I have to start the male patient at a little bit of a lower setting, meaning if you start at a really high setting, they'll be extremely fatigued. It's like a pretty intense workout after even only five or 6 minutes of treatment. So I kind of work my way up. But the men definitely notice improvement in erectile function. I think working together with other components to treating the core, it's obviously a missing piece for a lot of people, but especially men, because again, my observation that men seem to have a weaker pelvic floor. And I want to circle back because there was a comment made earlier about couples coming in. And this has been an observation I've had in the practice over the last 2 years, a significant increase in the number of couples coming into the practice together, both on the purely cosmetic side and on the functional side. So I think that's something we might want to think about as far as how we market, how we talk about the procedures, and how we kind of welcome people into the practice. Because the other observation is my most loyal and committed patients, when couples are coming in together, they spend a lot more together, they do a lot more. So it's a win-win. So I just want to mention that.
So we started treating a lot more men after some of the COVID papers came out about erectile dysfunction. And in several of those papers, it was 20%. So, and that's obviously likely to be very underreported. People don't always feel comfortable talking about this.
Yeah.
And so I did an article in New Beauty magazine specifically with a urologist talking about post-COVID erectile dysfunction. That seemed to capture some interest. And then, as JD indicated, letting people sit on the chair for just a couple minutes. And I have to be honest with you, it's something that I do at the end of the day when I'm done charting on the computer. I'll just pick up a book and sit on there for 30 minutes, 28 minutes myself, and just read in the peace and quiet of an office when nobody else is there. But a lot of the people often push back and say, how is this different than the high impact workouts that I do? How is this different than doing a whole bunch of Kegel exercises? So Dr. Wallace, can you just go through the mechanics of why this is so different than Kegel exercises and how this is so different than anything you can do on your own at a workout?
So yes, thank you. So a Kegel exercise basically is another term for a pelvic floor contraction. And having been examining women for over 20 years, women think they can do a pelvic floor contraction, but really probably 7 to 8 out of 10 women cannot even recruit their pelvic floors. And I see some nods from my other colleagues. And so not only do we not know how to recruit those muscles, but then we have weakness in the area. And so when we're doing a pelvic floor contraction, not only is it difficult to just achieve one, but there is no way in our lifetime could we achieve 12,000 pelvic floor contractions in 28 minutes, which is what Emsella does. And then when you add the high fem to the pelvic floor, you're having a super maximal contraction. So the muscle is contracting above a normal action potential. And so you're having a contraction that, again, we could never achieve in our own ability. The other thing that I think is important to point out to patients is that most of us will be good with some pelvic floor training if we go to a physical therapist. And I think that physical therapy is a very important part of awareness, of breath, body mechanics. And so all of my patients, I offer and refer to physical therapy, but then I am always emphasizing that there is no way that you're ever going to be able to gain the strength and not only hypertrophy, but hyperplasia of that pelvic floor, which we now have in studies when you're doing these kinds of contractions on your own. And there's a maintenance process to this. So I talk to my patients about bodybuilding your pelvic floor. So that's a little easier for them to understand.
So Dr. Franz, we know that there are other treatment options available for incontinence, but when you talk about our biggest patient population being women, postpartum, postmenopausal women from either aging, vaginal delivery, menopause, nerve issues in that neuromuscular connection, how do you talk to them about EMSALA, and how do you position this in the context of some of the other treatments that you offer, including other non-invasive treatments as well as surgical treatments?
Well, actually, some 10 years ago, we had some electric stimulation to put this first, which didn't work at all because the compliance was not high enough. In our office or in our practice, we do have laser treatment and we do have EMSALA. They do differ, or I personally always offer first EMSALA treatment as this is not invasive and it's the first step. You always should use something which is conservative, which is not invasive as a first step. However, this does not mean that this is the only treatment. That's the first point. The second point is then when you have women shortly postpartum, like about some weeks or some 2 months or 3 months postpartum, and they suffer from incontinence, you should not start with EMSALA, because in this case, EMSALA would train and would put too much power on a ligament in the pelvis, which is called pubo-urethral ligamentum, and which is the one which is stressed in the delivery. So in this case, you would use, for example, radiofrequency as a first step. However, for all patients who are not shortly after delivery, it's always the EMSALA first, because you have two things. You have the training, which is a very important thing, and you have a very, very strong training, because it's not like engine, not like electric power just going into your muscle, and it imitates a nerve contraction, and it leaves your body as soon as possible. However, it is a magnetic stimulation which goes through the whole muscles, and it contracts all the cells. It leads to a contraction of all cells without using the nerves. So it's a very, very strong contraction, which is much stronger than any kind of other contractions we know. And doing this kind of contraction, this passive contraction, you also remap your recognition of your pelvic floor muscles in your brain. So this means after having these 6 sessions, or in my case, I always use 8 sessions in people over 50, because your muscles need more training the more you get older. When you train them after that, they much easier can train themselves their pelvic floors. So this is how I offer to them. However, if there's any other disease of genitourinary syndrome, like atrophy or something, we have to talk about other therapies. Or we can add it to other therapies. Let's say it like this: we always add it, because we always offer it as a first step in any kind of incontinence.
So Dr. Holden, we're not successful in our practices unless our staff is really behind us, helping us talk to patients about procedures, even endorsing procedures, and giving patients the many options for the energy-based devices that we have in our practice. JD and I both mentioned that we allow patients to sit on the machine in the EMSALA for a few minutes and try it out. What are ways that you get EMSALA busy in your practice, and how do you really get your staff behind you?
Great. I love that question. Okay, so first of all, in our lobby, we have a screen that plays looping videos. And we've created a series of 8 different patient testimonial videos of all different walks of life, different generations of patients talking about their experience with the different things that we offer. So we have things about EMSALA playing in the lobby with a patient sitting on the chair showing their experience. And patients, as they wait in the waiting room or they're checking out and kind of looking over, they're able to see this and ask our staff questions. And we have all of the flyers, the rifles that I was showing earlier, accessible to just hand write out with a quick little way to talk about EMSALA, strengthening the pelvic floor. We also have a custom app that we had designed by a company here in the United States. And we have a reward system built into this app. So kind of like Starbucks rewards, every time you come in, you check in and you earn points. And on your third visit, you get a free Emsella treatment. So that is the first reward patients earn after their third visit into our practice. And they're suddenly interested in, what's my free reward? Oh, can I come sit on the chair? And after they sit on the chair, they want to use their reward. They sit on the chair after they're medically cleared, of course, and it engages the conversation with whomever's doing their demo, and they have them captivated for 28 minutes, and they can ask questions and then subsequently buy a package. So those are the strategies that we use in our practice, in addition to advertising on social media.
That's awesome. Dr. McCoy, you have a lot of different ways that you integrate this in the context of other energy-based devices, specifically Emsculpt Neo. So like Amanda did, can you tell us some of the tricks that you do in your clinic?
So one thing we did an analysis on what we think about as far as time value, as far as what we're doing in the office. So for us, if a patient is booked and they're doing a treatment, then I am perfectly fine with adding additional treatment at a significant discount because we've already got a captive audience. They've already got their appointment. We're not having to rebook another appointment, have someone call and follow up. So there's a time value to doing things while patients are in the office. So it's very common that we'll add additional areas of Emsculpt Neo to their current package.
Dr. Mahai, if you want to take over and talk about how you combine this with other procedures in your office.
Yes, so usually I tell my patients that every woman should use the Emsella chair. So if she had a pregnancy, if she had a delivery, if she didn't have, if she's in menopause, if she's young, if she's fit. So I tell them that like you are going to gym in order to train the rest of your body, you should use this at least preventive or as a treatment, depending on the stages you are. So for example, I have my friends, younger friends even, that are doing like at 20 something years old that want to, they are going to the gym all the time. They want to be very fit. They want to have a very good sexual life. And they come and do the Emsella chair one session per year, for example, because they didn't have a problem. I'm doing IVF and obstetrics, and for my patients after C-section even, I'm referring them for the Emsella treatment because I'm explaining like this. So why after C-section you should use the Emsella? Because you didn't have a vaginal delivery. But our body, the women's body in those 9 months is preparing to the natural delivery. It doesn't prepare only in the last 2-3 days. So the body doesn't know that Monday morning at 8 a.m. you have a C-section. The body already has been starting to modify the muscles, the bones, everything there, the collagen fibers, everything is prepared in order to let the child go through labor outside. So even if she has a C-section, she should use the Emsella after some time, of course. Other patients are those ones with the pain, and I'm combining them if the patient comes, for example, for menopause. I'm doing hormonal replacement treatment as well, but I'm referring them for Emsella treatments in the same time. I combine it with the laser, the CO2 laser I'm using in menopause. And as you said, the GSM, the genitourinary syndrome of menopause, only by the atrophy can cause urinary incontinence. And in this condition, first of all, we should improve the vaginal tissue with hormones, with topical products, with local treatments, depending on the case of the patient, with the laser, with the radiofrequency. Use something first to improve the atrophy, because if you use only the Emsella in this kind of patients, it will not work so good. I'm using the PRP as well for these patients or for the others. So we have different tools and we can combine each other. The great thing about Emsella is that you can combine it with anything, with the PRP, with radiofrequency, with the laser. You don't have any contraindication. So that is a very interesting thing. So for all the patients that come in the clinic, not depending on the problems they have, I recommend them the Emsella chair as well.
I so agree. Combining with anything in the office really works. And the fact that if the machine's available, you can put somebody on for a little trial. Dr. Wallace, there was a question specifically about someone who saw you lecture in Orlando and wanted to hear your combination therapy soda can analogy. Can you go through that with us?
Oh, sure. So the soda can analogy is actually a way to describe the core, and it's used in physical therapy and in sort of chiropractic arenas, and actually bodybuilders as well. So I'm a lifelong fitness fanatic and weightlifter as well. So the soda can analogy refers to, if you look at a soda can that's intact, the top here you can think of as the diaphragm. The sides are the abdominal wall and the long back muscles, which make up the core, because we think about the core as mostly the abdominal wall, but we can't forget about the other things that make up the core. And then the bottom of the can is basically the pelvic floor. So when all of those sides are intact, the soda can really, you cannot crush the soda can. And that's what's really the soda can analogy. So when you think about the core to floor analogy as related to a soda pop can, when the diaphragm, the abdominal muscles, the long back muscles, and the pelvic floor are all strong and intact, you have a strong core to floor. That's it.
So JD, I know you work out all the time. You're in good shape. You know, I think Patricia's really core to floor analogy works in a lot of different people for different exercises and different reasons. I always feel like I ski better after I've done my M-Sculpt Neo treatments. And when I'm bouncing around on the moguls, and again, I do use my M-Sala late at night when no one's around. Where do you see the M-Sala and the M-Sculpt Neo really helping out in your own life, in your patient's life? And again, we're talking to somebody like you who's done these studies on older populations in combination therapy as well as postpartum populations.
Well, I'd say it's probably one of the neglected body groups, because we just historically haven't had tools that we could use to really effectively treat the pelvic floor. And now that we have that tool, and I've started incorporating it for myself and for patients, what you get is just this amplification effect as far as overall functional strength, stability. And, you know, we haven't talked about it much, and it relates more to M-Sculpt Neo, although you can get kind of the lower glute if you position yourself a little differently on the M-Sella chair, is we can't forget about the glute, because that is technically the largest muscle group in the region. So I found probably the most powerful changes that have happened in patients is where we're treating the full core, where we are treating the abs, we're treating the pelvic floor, and we're treating the glutes. So often what you'll have is you'll have patients that do treatment, and what I tell my staff and myself personally with every patient is everybody wants to know what their next step is. You know, I used that term in my video earlier, that it's a marathon, not a sprint. Patients want a plan. They always want to know what is the next step. So when it comes to anything with the functional body treatment, the next step is, well, what's the next body area that we're going to address? So if they haven't treated the glute, that's where we're going to go next. If they haven't treated the obliques, we'll treat that next if we're treating the pelvic floor. So making sure you have a next step in place. But it's been really rewarding too, because I've had patients that, you know, years ago, I wouldn't have really had a tool to treat them. Patients that are like long haul COVID. I've had a lot of patients that have come into the office that had major muscle atrophy, treating it with M-Sculpt Neo and M-Sella chair. And, you know, they've gotten functional improvement where they're no longer needing to use a walker or a wheelchair, which is kind of crazy as far as kind of the kinds of changes that you can see. But me personally, it's elevated my game for sure. The M-Sella chair, when I did that with glutes, short series of treatment, my deadlift went up 35 pounds. You know, so for someone that's like training consistently and all of a sudden you see that strength increase, that's pretty powerful. And there's a lot of people that will pay a lot to get that kind of change. So that's kind of cool.
You know, I really applaud BTL for doing these studies like you've done, looking at this apparatus to measure your core strength. We can look at specific parameters and pressure. We can look at patient satisfaction and really see those things. But it's some of the anecdotes that patients come in reporting and what they're better at. So, I have patients that do these high impact, different types of workouts, oftentimes on a trampoline. And many women report that they just don't have urinary dribble. They feel really more confident what they wear to these workouts. So, one of the questions that we get in the chat area, I'll give to Dr. Holden here, is we have protocols established. We do 6 treatments for 3 weeks, so twice a week treatments. What if you do more treatments? Like, where do you sort of integrate your thoughts to your patients about the number of treatments and really the frequency of treatments?
So what I do is I kind of look at it as per decade of life and their functional problem. So I'm not directly measuring like an OBGYN would or a Urogyne would or anyone else. So I'm basically asking about symptoms and if their symptoms are improving. So say I'm treating someone younger, 20s to 30s, to strengthen their pelvic floor. I'm probably going to do a 6 treatment session. If I'm treating somebody older that has lost their muscle mass, because we lose muscle mass as we age, I might do that 12 treatment session in somebody 60, 70, 80, and they will regularly come in and sit on the Emsella on a monthly basis to strengthen their pelvic floor and combine that with their workouts. But you're always going to ask them, like, what is their physical goal? What is their physical goal? Where are they starting? And what symptomatic improvement are they seeing? So some people, they do their 6 sessions. They see a massive improvement in, say, urinary incontinence. There might maybe 30 to 40. They've had children, vaginal or cesarean deliveries. And over 6 to 12 months, they kind of see a return. So now they're going to want to do a full treatment again. I feel that the maintenance is really best. So we have a medical gym membership, and people can purchase, once they've purchased a body area, whether it's Emsculpt Neo, one of the body areas that they purchase, or Emsella, they can then pay a monthly fee and come in at a reduced rate and come in to their cadence that their body would like to see treated. So then they might come in monthly basis and treat core to floor, abs, glutes, pelvic floor to maintain. They might come in quarterly. They might come in twice a year, or they may treat all over annually again. So there are all kinds of different strategies. I would say the older you are and the more dysfunctional, the more you're going to need, and then the more maintenance you're going to need. But my patients say it really, really wakes up their muscles. So I don't know if anybody else has comments about that waking up sensation, but I mean, even like I had a patient yesterday that said, wow, I just feel like I spontaneously contract sometimes, and I didn't have those muscles just to recruit before. Now my brain like almost feels more alive. So Patricia?
Amanda, I will say that patients sit on it. They notice an awareness right away after the first session of just feeling lifted. They're sort of walking differently. They're even like their yoga practice is different. Piggybacking on what you were talking about with memberships, and all of us probably have our own way of how we keep patients coming back. My patients, 20 to 105 sit on the Emsella, just like Dr. Mihai said. I think every woman and every man that walks into my practice should get strong from the inside out, is how I put it. And I also stress the importance of coming back. Our data goes out to 6 months, and there's a small drop off, at least in the quality of life questionnaires. So it makes sense for my patients, for the most part, quarterly, once every 3 to 4 months, to come in, and they're on a lifetime membership, if you will, to come in and stay strong, we call it, in the pelvic area. Not to forget high protein diet, hormone optimization, especially in the older patients, because it's going to be harder to build the muscle and harder to maintain it if we don't have all of those other aspects. And I think the other physicians would agree.
We heard the word brain mapping, and I just want to continue with the theme of mapping. Dr. Franz, one of the things that we hear from our patients is that they toilet map. A lot of times, men or women will go to a public place, they're at some sort of social event for a few hours, and the first thing they do is just make note of where the toilets are. And honestly, at what point in the course of your initial treatments do you start noticing improvement in that? And what have your patients told you?
Actually, normally it's we tell our patients that it Of course, we know that you can expect the first results after the second or third training. However, the muscle gets restored and gets more powerful after a period of 4 weeks. So you need some time. So I always tell my patient not to expect to have an effect immediately after the first training, but to wait for about 2 to 3 weeks after the last training session. So to be honest, I have to confess that I don't see my patients when they have their trainings. I see them before my day trainings. We have an evaluation of the results after 4 weeks. However, meanwhile, the training, it's just done by the nurses. That's one of the points why I like MCELA so much, because I have nothing to do. They just come in the office, they get out of the office, and the training and everything is done by the nurses. So I cannot tell you at which point, whether it's after third or after the fourth training, they have the first effect on this mapping for toilets. However, I know that after 4 weeks after the last training, almost everybody has an effect on this kind of mapping, looking for toilets, or has a strong effect on urge incontinence, which is actually, it's urge incontinence, what you're mentioning. It means that when you have to go to the toilet, you have to go suddenly. And this is kind of urge incontinence, and it gets better in most cases after a certain period. But you have to give it time. You have to give the vessels time, the perfusions time, the muscle time. It has to tighten again.
So I'm going to throw this question to Dr. Mihai. We're getting a lot of questions in the chat about some of the contraindications to MCELA treatment. So I just want to go over, patients remain fully clothed. This is a non-invasive treatment. They walk in and out of our practices. To make sense for offices thinking about this technology, this is operator free. You have patients sit down. So we'll have you go over sort of the positioning, but just to review, there's no consumables. And the biggest population for all of us is incontinence. So 200 million people worldwide suffer from incontinence. And the fact that BTL has sponsored these sexual function studies is really interesting. And there's a need for this because 45% of incontinent women really report a loss of intimacy. So where our patients may have some sort of joint replacement or somebody may have a pacemaker, those are exclusions in our practice. So can you talk to us about your experience and some of the contraindications that you discuss?
Yes, as you mentioned, the pacemaker. So you can think about the MCELA like an MRI. So basically what is contraindicated to use in the MRI is contraindicated here as well. This is the most simple thing. But if they have any implants in the upper part of the body, there's no problem. The idea is not to have any metals in the lower part of the body. So for example, one discussion, and they shouldn't be pregnant, of course, and they shouldn't be at menstruation. But an interesting subject that we many times we discussed about is the IUD. So some say that the IUD is not a contraindication. Some don't use it if the patient have it. It's different if they have the Mirena, for example, the not with copper. If they have the IUD with copper, the MCELA BTL actually says that it's a contraindication to have any kind of IUD. I know I have doctors and I discuss it. It's not only about the copper and the metal, but it's the idea that those contractions can modify the position of the IUD as well. So I don't recommend the patients with IUD to use the MCELA. I'm curious what the others say about this aspect, if you are recommending them, or if you recommend first to change it or to take it out.
So for people who have any history of any other issues, particularly if they have like an implanted neural stimulator of any type, we exclude them. Even
Yes.
drug pumps actually may be interfered with as well. Does anybody else have specific circumstances that have come up? And there was a question about copper IUDs being fine. What are your thoughts on that, panel?
I have been avoiding the copper IUD. I don't avoid it in any other IUDs, and I avoid in pacemakers, things that are more, life-threatening in the heart. Most other titanium implants, if they're able to go into an MRI, I take each patient as an individual basis and I treat them. And I've had no issues even with hips and knees, actually, with the Emsella. And even with the M-Sculpt Neo, depending on if they have small hardware somewhere in their back. So again, we're thinking about the penetration. It's recruiting the muscles. It's not something that is, going through and through to the body all the way. So that's how I practice, and every patient is individualized.
Very similar to
Dr.
Dr.
Holden,
Wallace.
can you go over? So Dr. Holden, can you go over like the positioning? When you walk into a room with the patient, you have them sit down, you trained your staff to really get them to really find the right positioning. Walk us through that, please.
Okay, so I have a pelvic floor model, and I am at my home office right now, not my regular office. Otherwise, I'd pull it up and show it to you. But if you just buy a pelvic floor model and it has your bones of your pelvis and then your musculature on the bottom, I first have my staff show the pelvic floor model and show where the perineum is. And we say, this is, if we're treating a female, this is your vagina, this is your anus. We want you to position right in this perineal area. So it's not awkward. You're not saying it in a weird way. You're just straightforward with it. And then I say, now look at the middle of the device. I want you to think about putting your perineum right in the middle of this device as you're first positioning yourself. And you can spread your legs wide as you sit down, kind of lean forward and get situated in that middle of that device. Oftentimes we'll kind of demo kind of how to sit and how to get in that position. And then they feel comfortable. They sit down in the chair. We slowly turn on the tapping phase just to get them positioned. And I say, if you feel it too much in the rear, I want you to scoot this way. If you feel too much in the front, I want you to kind of center your perineum right there. And they're always saying, like, in the very beginning, they always go, okay, well, I don't really know if it's getting exactly the right location. And I said, well, just get it good enough, and then we'll dial it up from there. And then as we dial up the contraction, we always start with protocol 1. We're dialing up from 0 to 100 just to get them comfortable, get the blood flowing, and make sure they're in the proper position. And then we go up from there. But we let them kind of have a steady state in the first few minutes, just so they're really getting used to that protocol. So what do others do on the panel?
A tip that I've tried to explain to my staff is if someone's if they're a taller person, to raise their bum up a little bit. I feel like they actually get a little bit better sensation in the center of the pelvic floor than if their hips are, well, for sure, if their hips are lower than their knees, they're not going to get a great sensation. So that's a little tip for taller people. I've had to adjust even just in the last few days. I'm listening to someone as they're putting them on there, and I run in there and kind of help them position them to make sure that the patient's feeling it in the right spot. And then even the patient can glance over at the control tower, and it shows the little coil coming up. And I say, see that little coil? That's what you're wanting to sort of envision stimulating the center of your pelvic floor. And I use a pelvic model too, as well, when explaining to patients.
I think I need to get I need to get a pelvic model because we use a little peach. So we show them a peach. I'll send you the
link of the one I have, Judy.
Yeah, and then the only thing I wanted to add is what I like to add is an active component if the patient's open to it, is making sure that the chair is at the right height so that their feet are flat on the ground, and then you can actually press through your heel, which will actually engage the glute and actually engage the pelvic floor. If you haven't tried that, try it. It makes it even more fatiguing. But what you can do is just kind of gently press through your heel while the treatment is going, and you get an enhanced engagement of the entire pelvic floor.
Dr. Mahai, I mentioned some of the data. 45% of incontinent women reported a loss of intimacy, and that data applies to men as well. So how do you bridge that discussion between talking about stress urinary incontinence and intimacy in your patients?
So I'm the national and international trainer in the laser, in the PRP, in the MCELA, in the Exilis. So I have a lot of instruments that I can use to help my patients. All my patients, and this is what I'm training at all my courses. So when I have a course, I say to everyone, if you start asking your patients, like you ask them, how many deliveries do you have and when was your last menstrual period, start to ask them, how is your intimate life? How is the sexual intercourse? If it's any pain or if they have orgasm. If you start to ask everyone, you'll see how many couples actually have problems. For example, I had some patients, I asked her, do you have any problems during the intercourse? No. Do you have any orgasm? No. Do you have normal lubrication? No. So how it is not normal? Because they are not used to talk about this problem. So it's our duty to start to ask them about this. So when you start the discussion, I ask them like I ask any other question. When's your last menstrual period? How many deliveries do you have? And then I want to talk about the intercourse. Is there any pain? If the lubrication is normal, if they have any bad reaction, any problem, and if they have orgasm. And even for the orgasm, I do the PRP and I combine it with the MCELA in order to improve the pelvic floor muscle and to enhance the sensibility as well with the platelet-rich plasma. So the patients with pain during intercourse, we need a very good examination to know what kind is this pain. So for example, if the pain is in the belly, in the abdomen, it's profound, we should first think about infection, do an ultrasound and think about other aspects. But if the pain is superficial, then it can be due to vaginismus or it can be due to genitourinary syndrome of menopause. They have atrophy. So in this case, you use first something to improve the atrophic tissue. I saw there a question about the patient with bowel removal, and she had pain during intercourse after this procedure. So the same, it's very important to see why she has this pain. If the pain is due to some muscle contraction, then the MCELA is good. If it's not due to this, probably maybe she had some local radiotherapy. And in this condition, she has some atrophic tissue, and you should use some fat grafting or PRP or hyaluronic acid, something else. I had patients with brachytherapy after cervical cancer. I had patients after the bowel remover. They had, for example, in order to put back, then to anastomose the bowel, she had a colostoma. It was required to have a certain pressure in the anus, in the muscles. So she couldn't achieve this after 1-2 years of doing different pelvic exercises, electrostimulation, and not any improvement. So she did 10 or 12 sessions of MCELA, and then she went back to the surgeon. They did they measured the pressure in the anal sphincter, and it was perfect. And she had the surgery and put back the bowel, and she had a normal life. So this can be another indication, but in this condition about the positioning, the patient should not sit with the perineum in the middle of the chair, but with the anus. So because we want to trigger first the muscles from the anus, and she had very good results, and for men as well.
Right. So again, with the statistics of urinary incontinence out there, and that really being the driver to bring patients into our practice, does anybody else want to comment how they transition to talking about core strength and the necessity, or really how this could help patients of different ages, and then also how you make that tradition in both populations, the incontinence as well as really core strength patients, to talk about sexual health? I think those are good tips to talk about frequency of intercourse and the quality of intercourse. Anybody else have thoughts on that?
Do you want to go first, Dr. France, and then I'll answer after you?
So thank you very much. I think that, of course, as an obstetrician or a gynecologist, we have it easier to talk about these things because this is originally our focus. However, I would like to say that having devices like Imcella or radio frequency or whatever, with which you can treat these problems, it also changes your attention as a physician. So getting these devices is not only good for your patients because you have a device to treat your patients. It's also good because you get another intention on other issues of your patients. You have a personal interest to ask your patients about incontinence, to ask your patients about vaginal disorders, sexual disorders, whatever. So this changes to some way, this changes really your daily routine and how to talk to patients. And after you do it a while, you will lose any kind of shyness or something to talk about. If you just ask them, you just, as Dr. Mihai said, you just ask them like a routine question. Do you take any medications? No. Do you have incontinence? What is about when you jump, when you exercise? Do you have pain while sexual intercourse? This is totally normal questions in my office, but it became totally normal questions because I got the laser and because I got the Imcella. If I didn't get that, probably I had no treatment, so I had no interest, so I wouldn't ask for it. So look from it from the other side. This one is something which enables you and which turns your attention. And just about the positioning before, let me just ask one sentence. I do it in the same way as you did, but what we should do, or what I would like to mention is that I ask all my staff to use it as well. So if your staff uses it, and if your staff knows how it feels and what it can bring to your physical health, your staff will also be telling it to the patient, and they will be easier able to position the patients in the right way because they know themselves from their own training how to position in the right way. Thank you.
So when I talk to other non-core type of practices, it's important in your intake questionnaire to have just a single question, as Dr. Franz indicated, that might then allow you to open that door to speak about whether urinary incontinence or sexual wellness. And we want to always acknowledge that sexual wellness doesn't just include intercourse, but rather all aspects of sexual wellness. We can have a perfectly healthy sexual life and not be in a partnership. And there are different types of partnerships as well. So although we talk a lot about intercourse this morning, enhancing sexual wellness with Imcella and the other modalities that we've mentioned can enhance orgasm. It can enhance confidence. It can enhance someone's energy. And so those are important things that I always like to point out, first of all, because it's not just about intercourse, it's about having a healthy sexual life in the body that you're in, and knowing the different aspects of someone's life at the different generations and the different challenges that it poses, not only for incontinence as we age, but for sexual wellness. For example, as we get older, we have physical limitations, we have atrophy, some of us have big bellies, and it makes being intimate difficult. And so you really have to get into that trust mode with your patients once you've crossed over into that discussion, and you can completely change their sexual health and their sexual wellness with core to floor strengthening, of course, but also just being able to talk about it with them. So I wanted to mention that as well.
Apparatus that you use to measure, JD, and then some of the changes and the satisfaction survey patients that have questions and want to know how many patients in these studies actually felt better about themselves, felt better about their strength going from a sedentary position to a standing position, and what other parameters were discussed. We'll have you comment on that.
Yeah, so the actual measurement was done using a biometric device that sits in the lower back, and while a patient is contracting the abdomen, it measures the pressure change. So with a higher core strength, you'll have a higher pressure, and there was significant improvement in 100% of patients treated. And I think the average increase ended up being across the board 27%. And the quality of life questionnaire related to everything from urinary incontinence, overall confidence, quality of life, sexual satisfaction, metric after metric, we're seeing improvements basically in anywhere from 90 to 98% of patients, meaning very, very high patient satisfaction. And it's, as you already talked about, the ease of the treatment being, very non-invasive. I think that that's a big part of it too, is because we're talking about a delicate subject matter to begin with. So when you compound that with a treatment protocol that is totally non-invasive, that is very simple, that is not painful, it's pretty powerful. And then when you look at the elderly population, all of those components are equally, if not more important, because with someone older, we want to have a treatment option that's non-invasive, less invasive. That's showing the biofeedback stabilizer that goes in the lower back. It's very simple to operate. And what we did is with each visit, patients, we did 3 measurements, 3 independent measurements, and we took the average of the 3 measurements. Very simple to use and very consistent. Patients were incredibly satisfied with this protocol. Meaning I've done multiple studies for different manufacturers, done a lot of data collection over the years, and this, out of everything that I've done, this was absolutely the most consistent and had the most positive feedback from patients. So basically, you're looking at satisfaction rates that are all above 90%. Basically, as I even noticed after the first week of data collection, 100% of patients noticed a positive change. But as far as looking at these kind of quality of life improvements, as far as ability to perform daily activities, spend quality time with the kids, overall satisfaction being higher. As far as the posture, these are based on the questionnaires, 91%. I can tell you, I looked at everybody's, because we did 3D photography in addition to the data collection from the questionnaire, and everybody's posture was improved. So that can be subjective, but it's pretty powerful when you look at the data.
So I just want to reiterate, this is a postpartum study that you did, and it was combining Emsculpt Neo of the abdomen plus Emsala. Several slides to Diane Duncan's study that was done on elderly patients. So basically patients over 60, they had the same type of measurement that was done on that apparatus. Yeah. And look, JD, if you want to talk to us about the results of that study, here's the biofeedback.
So what we can see is a higher increase in the actual core strength measurement through biofeedback. And again, we have very high patient satisfaction. So their core strength measurements actually increased more than the postpartum patients. So in this elderly group, but very high patient satisfaction as far as ability to get up from a standing, seated to a standing position, as far as broadly the ability to perform daily activities. Again, I don't know, I don't believe Dr. Duncan did 3D photography, but I have a feeling that if we looked at the actual measurements of posture, we probably would see higher than what we're seeing in the actual patient satisfaction, just from my experience with it. But again, like really powerful changes. And the thing we have to keep in mind is in this elderly population, these are also patient groups that some of the weight resistance exercise and some of the physical activity can either be risky or is not possible based on limitations as far as functional movement. So we have a tool that we can use with an elderly group that can be an adjunct that didn't really exist previously. So that's pretty powerful.
So I think this data and these studies are really important. They're really well designed. I'm wondering if maybe Dr. Wallace, can you talk about some of the studies that were done specifically on the incontinence patients from Dr. Barinholtz, we can pull up, Dr. Samuels, and Dr. Allensod have all published really QOL studies on how Emsala helps their patients with different types of incontinence, specifically and more particularly stress urinary incontinence?
The initial studies, looked at over 500 patients using the typical twice a week, 6-session protocol 1. And actually all of those patients had a significant reduction in urinary incontinence. I believe it was on the order of 65%, which is in this particular study. I think up to 40% of patients were completely dry. A lot of women got rid of their pads. And the satisfaction and improvement in quality of life was well into the 80s and 90%. And that persisted at 3 months. And then there was a slight drop off at 6 months in the quality of life questionnaires and the incontinence patients.
So let's go to the next study, Dr. Samuels' study. And if you could comment on that as well. I think it's a little further down. And then, patients often ask, this comes up after looking at the data, the studies, when would you repeat the treatments, and would you do another series, or would you just do kind of a quote maintenance couple treatments?
So, every patient is different. And there was a question in the chat about what do you do if someone's not getting expected results or getting better? And again, if you're not in a OBGYN environment or a Urogyn environment and someone is, soaking pads and wearing diapers, MCELA is going to give them some strength, but that's always my first treatment, no matter what I offer patients, be it an overactive bladder urge incontinence or a stress incontinence patient, because having a strong pelvic floor is truly the foundation to all of the other treatments that you can offer someone. But you also have to always mitigate expectations. And so when someone is not getting the results that they want, then you can move on to either doing another 6 sessions. You have to be careful about fatigue, because some patients, as Dr. McCoy mentioned, they can get fatigue. And if you see someone getting worse and they're going twice a week for the first 3 weeks, you may want to back off, especially someone who has, significant atrophy or they have hypertonicity, and try to get them to come in once a week. I'll often do a second 6 sessions, and then we're going to wait and we're going to do basically a maintenance stay strong at 3 months. Some patients go, I'm starting to drop off, and I'm like, come in once a month. So it actually is a very much patient dependent, but it starts with educating the patient about what it's doing and also setting expectations. If we do a sling for stress incontinence, the dry rate is 85%. And that's now, well out 15, 20 years. It lasts a long time, but people leak for other reasons. So if leakage creeps back in, you're going to want to ask very specific questions about how are you leaking, why you're leaking, and is this, being strong in the pelvic floor going to address that specifically?
Dr. Mahai, if you want to comment on really maintenance treatments and frequency for other subsets of patients as well, in particular sexual function. Or Dr. Franz, if you want to take that.
Actually, we use the same protocol more or less as with incontinence in our case.
Fair enough. All right, and then as we wrap up here, I think, we all have many different devices in our office. I do a lot of clinical trials, but most of my patients are coming in for resurfacing. Ablative resurfacing is the thing that I publish the most on, that I do the most on, and treat the most on, and teach the most on. But how do you transition, maybe Dr. Holden can take this one, from the things in your office that may be totally unrelated, like resurfacing, to transitioning to talking about really M-Sculpt, Neo, and the M suite of products. And, your gym membership, we have something similar. If somebody's done a course of treatment with one of our BTL devices, we offer a membership, and then patients can have a reduced rate. And this dovetails with maintenance therapies, where patients frequently ask, well, how should I maintain these results? You can get a gym membership, but then how do you cross-pollinate to the rest of the M suite of products?
So whenever I'm doing a new patient consultation, I always talk about how we not only can help our faces age differently, but now our bodies can age differently. and we can enhance our natural beauty, not only in our faces, but also in our bodies. I talk about the fact that BTL has more clinical studies than any other device out there. And that's why specifically I chose to put these machines in my office, because it's based on science that these machines actually work. They're not gimmicky. There are lots to choose from out there. But with these BTL devices that I specifically have chosen for my M Suite, we can now target 10 different body areas and our pelvic floor, in addition to treating cellulite and helping with sexual dysfunction and urinary incontinence. So I make it a super simple conversation like that. And then they say, tell me more. I also can't stress the importance of these trifolds. We have in each patient room where the patient's face, when they are sitting in their treatment chair, we have 12 trifolds sitting there looking at them. So I can pull these out and show them the different devices that we have and what they do. So when you're treating your patients, you want to bring up these things periodically and kind of study what they've done in your practice before they come in to see you, so that you can bring up strategically certain things that would benefit them. Because if you don't bring it up, they might ask the practice right down the street that has the same device to do the treatment on them, pay for it there, just because they don't know you have it. So don't be afraid to talk about things on each and every visit, and talk about all the other devices that you offer, because you're doing your patient, basically you're not giving them all that you possibly can if you don't talk about face and body. So that's my.
So we did the FDA study for the flank applicator for Emsculpt Neo. I was actually the first US patient treated. And as it's the first day of summer, JD, talk to us a little bit about how you get patients to think about what they look like in a bathing suit, and how this is going to be a confidence booster for them when they're doing these Emsculpt treatments and when they're incorporating the BTL technologies. And then we'll turn to somebody else who has M-tone, or I can pipe in about M-tone as well. Same question.
Yeah, so one, like you just mentioned, I do the treatment myself too. So I talk about my experience with it, and I also treat my mom. And patients always ask, "Oh, what are you doing with your mom?" Because if my mom's doing it, they want to look at it too. And believe it or not, my mom wants to get in a leopard skin bikini. That's another story altogether. She's 73 and she looks fabulous. But the big thing is just talking about the device. So even if I'm doing some neuromodulator or filler, I'll mention, "Oh, have you tried the new Edge applicators? Have you tried?" And I demo the device. To me, I've always said I'll stand out on the corner of the street and hand out $100 bills if it's going to bring a patient in to do a new treatment and be a new patient or do a package with me. So for me, it's a great investment to do a demo of the device, especially because if they haven't experienced it before, when they feel that super maximal contraction, it's like nothing else you've experienced. No matter how hard you work out in the gym, you're not going to feel the same response. So that's my basic take there.
So Amanda, do you want to chime in there, or anybody else on that?
I can absolutely chime in there. I mean, if you do demos, the patients suddenly understand it on such a higher level. I don't do all the demos, but I'm going to start doing a lot more. I did one just a few days ago, and I'm able to talk about the areas that I've treated. And the minute you get on the devices, like say we're talking Emsculpt Neo, I remember the first time I tried it, mentally, I thought maybe it was gimmicky, but then I got on it and it was the best contraction I've ever felt in my abs. And so I constantly share that with patients, like, okay, 'cause I know you're going to be a little bit nervous, because they always are a little bit nervous, like what's this going to feel like? And I say, just be comfortable. I'm going to dial this from 0 to 100 based on your tolerability, and you're going to have the best contraction you've ever felt. I never want it to be painful, but I want you to feel this contraction deeply. And suddenly it's that wake up of the muscles, whether it's your abs, your glutes, or your pelvic floor. I would say those are my top 3 favorite treatment areas. Emsculpt Neo glutes as a supplement. I mean, that I personally have had a herniation in my back, a disc, and had a microdiscectomy. And I have to keep my core strength upright and strong And glutes, treating my glutes has changed my posture in terms of like just the way I am on a daily basis with health. So sharing your own personal stories. My mom also, just like you, JD, has urinary incontinence and regularly treats with Emsella and absolutely loves it. So both with personal demos and stories from our families, they're really powerful. I know Patricia Wallace has the same sort of thing that she shares with her.
Well, we mentioned.
Yeah, go ahead.
No, go ahead. You were going to ask me something. I was going to talk about M-Tone as an addition to the M-Sculpt Neo, because I have a lot of experience with M-Tone, and I find that it's actually a great treatment for cellulite. I do see that, 4 is a start point, and I think people tend to do a little better after they've done 6 or 8 of those over time, and always reminding clients that it takes a good 12 weeks to see the maximum changes in the skin after M-Tone. But getting ready for summer and getting into a bikini, I just was hiking in Joshua Tree, and I'm like, oh boy, I got to hit the front of my legs with M-Tone. It has been about 6 months. And so I feel like once you get that achieved result with the M-Tone, it's actually something that stays quite a long time, and you might have to hit it once or twice a year in the area. That might be a problem, because as we already were told earlier, our collagen and our muscles are breaking down faster than we can keep up.
So that was going to be on my questions. How do you make the transition from talking about the pelvic floor with your medical and surgical patients to other areas and feeling good about themselves sexually, as well as, from the appearance, intimacy, as well as even just in a bathing suit, being summertime? I think we oftentimes think of M-Tone for something for cellulite, but it really is a laxity treatment for people who've had kids. Some of the laxity that you see in the abdomen, sometimes people who have a lot of history of workouts and musculature, they get some laxity on the area just above the knee, and M-Tone can help with that. And then, call it what you want. Some people call it bat wings. I call it teacher fat. But when people write up on the bulletin board or something, the chalkboard, you get that little underarm dingle dangle. So how do you transition these conversations?
Well, just like Dr. Holden, I have brochures and banners in my reception area as well as in the rooms. And so certainly we talk a lot about function and form in my practice, but we also talk about feeling and looking good from the inside out. And so it's sort of a discussion that evolves when I'm talking to a patient about their body wellness goals. And it starts from their inside function goals to their external goals. And so it's always on that list of what else can I address for you? How do you want to live your best life in your best body? How can I help you achieve your weight loss goals and your skin goals? I don't do any aesthetics as far as face, injectables. Right now, my practice is very focused on body wellness. So that's the entry point. And then I utilize, pictures of real life patients. I myself, those who've seen my Instagram or heard me talk, my abs are an example of what M-Sculpt Neo and M-Tone combined can do for someone who's had 3 babies and is about to turn 54 in a week, right? So that little paper bag skin in a lean person that goes over the belly button, that's something that only M-Tone combined with M-Sculpt Neo would have fixed on my body. So I also use myself. And then I show real life pictures, patients that have a little bit of flesh on their bodies, because most women and men have flesh. They're not, someone who's going around lifting weights and necessarily doing hot yoga 3 days a week. So that's how I do that. And then I do demo the devices all the time in my practice. I will take extra time out to go put a patient on myself so that I can make sure that I can answer all the right questions for them.
I think these personal anecdotes are so helpful. I often give, as Amanda does, the example. I've had an open discectomy bilaterally and bilateral hemidiscectomy. And when you're rolling lasers and devices around, the ergonomics of that may not be great. But I just want to point out that the BTL units, whether we're talking about M-Face, M-Sculpt Neo, or M-Tone, all roll really well. And we have a designated area in our office for Emsella. So, and let's just wrap up here. I appreciate everybody being on there and taking your time. We still have 165 people that are listening here. And JD, can you just tell us some of your tips about, one, cross-pollinating to other BTL suite of products, and two, how do you get your staff behind you and really recommending these procedures to patients? And what do you do for your staff when they do this?
So it's been mentioned a few times, but I think getting the staff treated is really important so that they understand what the device feels like, what it's delivering, and make sure that they're excited. They see their results. And I'd say that's my other tip for cross-pollination is good photography. Meaning I have many amazing, beautiful before and afters because I've taken really a lot of time and energy into making sure that I have really good clinical photography. Because the proof is in the pudding. If you can show results, talk about it, demo it so that they can experience it. But if you can show them results and they're your results, that's really important. I know when you're starting, because I've seen in the chat, there's people that are starting to build their suite. You know, you have the clinical photography provided by BTL, but starting to build your repertoire of imagery is really powerful and really important.
Great. Thank you, everybody, for joining us. BTL has over 300 engineers that really develop these technologies. They're always innovating, thinking out of the box. M-Face is one of those examples. We did the M-Face study. We have almost 20 patients in that study, and I can show you the degree of improvement for these patients. And it's pretty exciting to be able to treat using different platforms and different technologies for BTL, and now with Exion having multiple devices on one platform. So if you have any further questions, reach out to your BTL rep, reach out to the company itself. Thanks for joining us.